Fortunately, I stand here before you today on behalf of over 240,000 members in North Carolina to oppose House Bill 115 for several reasons. It's unfair because this General Assembly stated this will be a session of no new taxes. However, with this bill, there is an implementation on the individual and the small business of a user fee or tax to pay for this bill.
To avoid conflicts of interest, the governing board should not include insurers or healthcare providers as voting members that would be subject to the regulation and oversight of the exchange board. Having insurers vote on plans in the exchange is akin to having Duke Energy or AT&T on the Utilities Commission.
Small business owners and individuals like me need to be recognized as part of the debate and part of the exchange. Consumer representation and health experts are essential to the exchange examining board. Insurance will be financially impacted by the decision of the boards, and their ability to remain impartial will be challenged. Do the right thing and provide balanced oversight on the Healthcare Exchange Board of Directors by increasing the number of experts without conflicts to the board.
Holy Scriptures of all faiths call us to be concerned about the health and well-being of everyone. House Bill 115 continues to benefit those currently in control. Insurance companies must not have a vote on the exchange board. The exchange must promote real competition and protect consumers.
All I'm asking is that we pause, we take a deep breath, and we listen to the stakeholders that matter most. The whole point of this exchange is for small businesses and working families to finally get some kind of relief.
We're equally concerned with the closed and restricted process with which this legislation was written. Consumers had no voice whatsoever in the creation of this bill. Contrast this with the open and collaborative effort put forth by the Institute of Medicine Work Group and numerous other stakeholders involved with that effort. And they created a more complete and effective bill, and this process falls far short by comparison.
I understand insurance companies have to make a profit or they're out of business. And I'm not here to put anybody out of business, but it is a clear conflict to have insurance companies voting on the board that governs their business. It's just wrong. It's like taking the fox, putting it into the hen house with a hearty bon appetit and closing the door behind it.
I don't like the idea that there's a user fee, and I especially want you to focus on clarity. The last time I ever got a document from Blue Cross that I could understand, it was a bill.
It is ironic to me as a more than decade-long advocate of healthcare reform that at the beginning of this session we were passing a bill to repeal health reform, and now we are passing a bill to implement health reform. However, the bill we're passing to implement health reform happens to be one that is very much supported by the insurance industry and other players.
We supported the high-risk pool as a viable option for those in the position only to be shut out by a $100,000 annual cap on specialty drugs that was imposed by the board of directors, which heavily represents the insurance industry. That the bill is only reasonable and reflects a fair and impartial process. Thank you.
I expect that I will buy insurance on the exchange in North Carolina at some point in my life. And right now, I do not feel assured that this bill protects my interests. The makeup of the board, the ability of insurers to vote, this does not leave me feeling reassured about something that will literally determine my health for years to come.
The way it's designed at the present, I believe the only ones who really benefit financially will be those who are part of the healthcare industry.
For healthcare reform to work, it seems to me that the main purpose of the exchange should be to establish a balance between the interests of insurance companies, which are focused on making profits, and the interests of people in need of health insurance who need access to affordable, accessible care. My hope is that we can establish an exchange here that also operates in the best interest of consumers. Thank you very much.